In addition to the benzodiazepines, and actually in preference to them, we have three other major types of medications. First, we're going to lump all sorts of medications into the serotonin agents, the SSRIs, the SNRIs, the SARIs, the NASSAs, all of those that we talked about in our unit on depression. These medications all work well for anxiety treatment because serotonin has an inhibitory effect on the amygdala. So when we increase serotonin, we're increasing the inhibition, the calming down of that firing, fearful amygdala. And yet it doesn't work immediately because of all of that initiating the signal cascade of the messenger systems that eventually leads to the increased release of brain-derived neurotropic factor, and that BDNF nourishes and protects the neurons. So all of those medications work well. Now, there's another class that is not used as frequently. It's much more of a second or third line, and those are the neuromodulators that we're going to be talking about in the unit on treating people with bipolar disorder. The neuromodulators work primarily on the calcium channels, calcium being one of the excitatory ions. It blocks when the calcium channels are affected. That blocks the release of glutamate, which is the excitatory neurotransmitter. But these are best used as adjuncts to 5-HT agents, and some of those would be, gabapentin and pregabalin. Finally, we have the adrenergic agents that block the central nervous system, sympathetic nervous system, autonomic arousal that can take place. And these medications, such as atenolol, clonidine, prazosin, and propranolol, are used more in PTSD and in extreme panic to calm down the autonomic systems of the rapid heartbeat, the tense muscles, the breathing, all of those that then trigger people to further worry and fear, and just becomes a vicious cycle. Now, I'm going to post a table that lists all of the different medications, and it's a table I've adapted from a source that I can't remember, so I can't tell you which one it is. But we've spent a lot of time in this unit looking at the benzodiazepine and the GABA receptors to understand that class of medications, because we will be treating these other classes of medications in other units, as we've already done with the unit on depression, and we will be doing in the unit on bipolar disorder with the neuromodulators, and also the unit on psychosis with the antipsychotic medications. So with that, we're finished with this PowerPoint presentation.